Are prednisone and prednisolone interchangeable? Prednisone and prednisolone are both medications that belong to a class of drugs known as corticosteroids, which are used to reduce inflammation and suppress the immune system. While they have similar names and are used to treat similar conditions, they are not completely interchangeable. Prednisone is a prodrug, which means it is converted by the liver into its active form, prednisolone. For individuals with normal liver function, prednisone is effectively transformed into prednisolone, and thus, the two drugs can sometimes be used interchangeably if considered appropriate by a healthcare professional. However, there are certain scenarios where one may be preferred over the other. Liver function. In patients with impaired liver function, prednisone may not be effectively converted to prednisolone. Therefore, prednisolone is often preferred because it is already in the active form and does not require this conversion. Bioavailability. Prednisolone may have a slightly higher bioavailability in some cases. This means that more of the drug is available for the body to use, which can be particularly important in severe acute conditions where a rapid effect is necessary. Dosage forms. Prednisolone often has more options when it comes to dosage forms, such as liquid solutions and dissolvable tablets, which might be beneficial for patients who have difficulties swallowing pills. Pharmacokinetics and pharmacodynamics. Although similar, there may be slight differences in the absorption rates, half-life, and binding efficacy to corticosteroid receptors between the two drugs. These differences can influence the drug's onset and duration of action, which might make one drug more suitable than the other depending on the clinical situation. It is important to remember that the interchange of these two medications should not be done without the guidance of a healthcare professional. Dosing adjustments may be necessary, and other factors such as potential side effects, the patient's medical history, and other medications being taken must be considered to ensure the safe and effective use of these corticosteroids. In summary, while prednisone and prednisolone are closely related and often used to treat similar conditions, they are not universally interchangeable. Decisions on which to use should be made on a case-by-case basis by a healthcare provider, taking into account the specific needs and circumstances of the patient.